If your symptoms return, you haven't treated the cause of the problem. And I say that in light of the fact that I see so many patients coming to me with handfuls of SIBO tests and several treatments, usually with some kind of antibiotic like Xifaxan, and they might be a little better for a while and then their symptoms come back. So, was the overgrowth of bacteria in their small intestine the cause? No, it was probably the result. So, what we want to do is we want to find out what is the cause of these fermentation symptoms. What I'm talking about here is gas and bloating. Fermentation means that there's either a bacterial or a fungal species eating your food and creating gas from it, and that gas gets trapped inside of you, causing bloating. So, really, really important to not miss the fact that there are causes underneath the fact that there's bacterial overgrowth, and there's several of them, but what I'm going to talk about right now, because I've seen the best results with this, is treating a sulfur deficiency and resolving your IBS and SIBO for good. I wrote a book about this, and it's right up here, called IBS and SIBO Permanent Symptom Resolution. I even know doctors who not only prescribe Xifaxan or antibiotics over and over and over again to their patients when they return with the same symptoms. I also know there are doctors that ascribe to the fact that you cannot ever eat a whole food diet again because those foods will just ferment. That's not my experience. Over the last 25 years, that's not my experience. When I replace the deficiency of sulfur, when I use sulfur to manage symptoms and get rid of the problem, the symptoms rarely return. I rarely see patients coming back again with the same gassy, bloaty IBS, SIBO diagnoses. And here's an example that I'm going to give to you based on somebody that I saw. Now, this is a 62-year-old woman, and she told me that she had the onset of her symptoms in 2018. And at that time, she was having a lot of constipation, diarrhea, bloating, and gas pain. She saw lots of doctors. She tried lots of treatments like herbal treatments and then Xifaxan. She tried a low FODMAP diet, so she took out the hard to digest cruciferous foods, the allium family foods, which are the garlic and onion family. She was wheat-free, dairy-free, egg-free, so she had all of these foods out of her diet, and yet her symptoms persisted. She had 4 different SIBO tests from the same doctor, and this is a doctor who actually teaches this as a normal treatment, as an acceptable treatment. She'd had 4 of these SIBO tests. They came back high for methane and hydrogen gas, and this doctor prescribed her rifaximin, which is Xifaxan, and neomycin. Her symptoms improved, then returned. They did this 4 times. And each time she did it, she had less and less and less improvement. That's probably because there's a fungal species that had started growing from too much antibiotic treatment with Xifaxan. So she was about to go back for her 5th treatment with this Xifaxan neomycin combination when she found my work. And she went, hey, hold up. Let me talk to this doctor. So we had an appointment, and we talked about doing the hydrosulfur protocol with my GIGNL1 powder. She ordered it online, got sent to her. She started the treatment. She started the titration of this hydrosulfur powder. She got up to the 30-gram dose gradually. There were some wrinkles at first we had to manage, but eventually she was able to get to the 30-gram dose, which is not atypical. If you have a deficiency of sulfur, sometimes you have to very slowly upregulate your system so that you can actually tolerate it well. Just be kind to yourself. Go slowly. When I talked to her after a week of her 30-gram dose, she told me her bloating had resolved, Her gas had resolved. Her bowel movements were regular and every day. She denied any kind of abdominal pain, and now she was actually getting hungry so she could eat, because previously she was so full all the time of gas and gassiness in her lower abdomen and pain that she couldn't eat because she felt full already from that gassiness. So that's one example. I have hundreds, thousands of examples like this. So before you ascribe to the idea that you need to eliminate whole foods out of your diet permanently in order to get rid of your IBS and SIBO symptoms, or whether you ascribe to course after course of antibiotics, check out some of the things that I'm talking about here first, because I think it's really important, not 100% for everyone, but it is very important for, I'd say, the majority of people that I see with these fermentation symptoms, gas and bloating, to get permanent resolution of their symptoms. So you can find tons more information with the videos that I've made. You can reach out and ask a question on YouTube or Insta or TikTok, and I will make a video and answer your question for you, because I want you to be well.